One of the most subtle yet serious risks of supplement use is that certain products, particularly those known for their anti-inflammatory, lipid-lowering, or general symptom-reducing effects, can mask the presence of deeper, more dangerous health problems. This is especially true with popular compounds like turmeric, curcumin, niacin, vitamin B3, red yeast rice, or green tea extract. These supplements may provide short-term relief or improvements in lab markers, but they can also delay appropriate diagnosis and medical intervention, giving a false sense of security while the underlying disease progresses unchecked. Take turmeric, for example. It's widely promoted for its anti-inflammatory effects, and some people use it to manage joint pain, digestive discomfort, or low-level chronic inflammation. While curcumin may reduce some symptoms, it does not address, or even identify, the root cause of the inflammation. Conditions such as rheumatoid arthritis, lupus, inflammatory bowel disease, or even hidden infections can all present with systemic inflammation and pain. If a person self-medicates with turmeric and the symptoms temporarily ease, they may postpone seeking medical evaluation. This delay can lead to missed early diagnosis windows, during which treatment is most effective and complications are still preventable. Niacin presents another case. It's sometimes taken to lower LDL cholesterol and raise HDL cholesterol, and in large doses, it can indeed affect lipid profiles. But niacin doesn't fix the underlying drivers of dyslipidemia, such as insulin resistance, fatty liver, genetic lipoprotein disorders, or thyroid dysfunction. If a person sees better cholesterol numbers after self-prescribing niacin, they may assume their cardiovascular risk is under control, when in reality, the root pathology remains untouched. Moreover, niacin in high doses can stress the liver and mask worsening liver function, especially if combined with other hepatotoxic supplements or medications. Red yeast rice is similarly misleading. It contains monocolin K, which is chemically identical to levastatin, a prescription statin drug. People who take red yeast rice instead of prescribed statins may lower their LDL cholesterol, but without the regular medical monitoring that accompanies statin use. Statins are usually prescribed with routine liver tests, muscle enzyme checks, and cardiovascular risk assessments. Red yeast rice users, on the other hand, may skip these evaluations entirely, believing they've found a natural alternative. This can lead to unrecognized side effects, especially liver injury or muscle damage, and a false impression that heart disease risk is being properly managed. Even supplements used to enhance mood or energy, like B-complex vitamins, magnesium, or adaptogenic herbs, can create diagnostic blind spots. A person struggling with fatigue, anxiety, or insomnia might begin supplementing in hopes of self-regulating their nervous system. And while they might feel slightly better, they could be ignoring the early symptoms of thyroid disease, depression, sleep apnea, anemia, or even heart rhythm disorders. The more effective the supplement seems at masking symptoms, the more dangerous the situation becomes, because the illusion of improvement can delay crucial diagnostic testing and treatment. This phenomenon isn't just theoretical. Many healthcare providers report cases where patients finally seek help only after symptoms worsen despite months or years of supplement use. By then, conditions that were once manageable, like early-stage autoimmune diseases, liver disorders, or metabolic syndrome, may have advanced, requiring more aggressive treatment or resulting in permanent damage. In these cases, supplements didn't just fail to treat the root cause, they actively contributed to diagnostic delay and disease progression. Another complication is that some supplements interfere with diagnostic lab results themselves. For instance, biotin, vitamin B7, commonly taken for hair and nail health, can interfere with hormone assays and cardiac biomarker tests, leading to false negatives or misleading results. Turmeric can alter inflammatory markers. Niacin can skew liver enzyme readings. These distortions may mislead both patients and physicians, complicating efforts to reach an accurate diagnosis. The psychological impact of supplements must also be considered. There's a powerful placebo effect attached to natural remedies, especially when they're recommended by charismatic influencers, integrative practitioners, or alternative health communities. People often believe that if they're taking something daily and feel not worse, they must be on the right track. But feeling okay is not the same as being healthy. Some of the most dangerous chronic diseases, such as liver fibrosis, atherosclerosis, certain cancers, or kidney disease, are silent until late stages. A supplement that takes the edge off fatigue or inflammation can lull a person into ignoring deeper, more urgent signals. To avoid these traps, Supplements should be used with a clear goal, a defined time frame, and regular medical oversight. If you're using something like turmeric, niacin, or red yeast rice to manage what seems like a chronic issue, it's crucial to first confirm that the condition has been accurately diagnosed and is being properly monitored. Self-treatment should never replace appropriate lab testing, imaging, or medical consultations. And any perceived improvement should be interpreted carefully, not as proof that the problem is resolved, but as a sign that further evaluation is still needed. In the end, supplements are tools, not solutions. They can support healing, reduce symptoms, and complement medical care. But when they're used to suppress or bypass symptoms rather than understand and address their cause, they become dangerous distractions. True health requires clarity, not just comfort, and delaying diagnosis in exchange for temporary symptom relief is a trade-off that too often ends in harm.